one of the biggest things about RIO Congress is how we're able to, show both live and recorded case presentations. And to me, these sessions allow attendees to witness real-time application of new technologies.
Arrhythmia Academy can go for advertising, hot research, late-breaking clinical trials that happen at major conferences, support conferences that are not major but are as good as them, like Live Cases Conference, and do case education for students and fellows, journal clubs. So it's a variety of things that we can do.
Welcome to Rhythm Interventions Unplugged, your monthly deep dive into the world of electrophysiology. Join us as we explore the latest research, share clinical insights, and provide practical tips to keep you at the forefront of your field. Now here's your host, the Director of Cardiac Electrophysiology at St. Bernards Medical Center, Dr. Devi Nair.
Hello, everyone. Welcome to today's episode of our podcast, where we discuss the latest in cardiac electrophysiology with the experts leading the field. Today, I'm thrilled to welcome Dr. Luigi Di Biase, a dear friend, and the editor-in-chief of the Arrhythmia Academy. Welcome, Luigi, to our podcast.
Thank you, Devi. My pleasure to be here, and especially with a friend, as you said.
Well, thank you. Arrhythmia Academy is new to a lot of our audience, and I want to take a minute and ask you about, number one, what inspired you to take this role as editor-in-chief of Arrhythmia Academy, and what is your vision to bring to this platform?
Well, as you know, Devi, all over my career, I've been working closely with, new technology, cutting-edge research, creating networking with friends and colleagues, and I collaborate to many EP journals as associate editors, executive editors, and despite the high burden of work and procedures, I felt that this innovative way of disseminating science was very intriguing. Post-COVID, everything became more important, the relevance of podcast, website, and I think this platform put the world together instead of put the wall down and destroy barriers. So what inspires me is having the opportunity with a platform in EP to really put the world together and disseminate science. So this is good for education. It's good for showing new technology to both colleagues, patients, and students, and be a way also for patients to access to what we do every day in the lab. So leading this platform allow me to support education, to support science, and also to support, as I can say, the dissemination of science in a very close way.
Yeah, I can't think of a better person who can lead Arrhythmia Academy, and I believe that Arrhythmia Academy serves an international audience. And now, how do you see your role in promoting this global perspective in EP education? Like, what from your experience in the EP arena, do you plan to change the direction of the content and how you're going to approach, say, complex case discussions on this platform?
Well, my role is easier because I don't have to do it all myself. I have to indicate which are the most hot topic, the most important trial. So this Arrhythmia Academy can go for advertising, hot research, late-breaking clinical trials that happen at major conferences, support conferences that are not major but are as good as them, like Live Cases Conference, and also do case education for students and fellows, journal clubs. So it's a variety of things that we can do. I just want to continue that there are a lot of meetings where we go where science is presented, but then is not advertised or repeated, and I feel that this is very important. Also, a conference and a web conference like the one that you have been leading for the last 5 years, like RIO, it's a perfect example of something that the Arrhythmia Academy wants to support and collaborate with, because it's exactly in the direction that we want to go.
I mean, I think I believe that this is going to be a great platform, as you try to bridge the gap between the research that gets presented and everyday clinical practice, right? So, and to have this year-round resource, and to me, that's what I'm looking forward to in following Arrhythmia Academy. So, since you brought up RIO Congress, I wanted to just take a minute and ask you, how do you plan to kind of collaborate and support these congresses and bring, do you have any specific educational initiatives or collaborations that you're hoping to introduce, in this collaborative platform?
Well, of course, yes, because in my mind, a journal club, a case presentation, and interviewing, the presenter of a late-breaking clinical trial are all important tools that we can utilize to disseminate science. But we also need the bread and butter of what we do. We need to show people how a new technology is working, what are the step-by-step that in the EP lab people need to see and need to do. And sometimes you have a lot of colleagues that call you, have you used this new technology, this new PFA system? What do you do? Do you give glycopyrrolate before the application? Do you use a deflectable sheet, a non-deflectable sheet? How you get access? Simple, very, very simple, but very practical information. So the way to support RIO is exactly that way. You're going to do your meeting, you're going to show live cases, you're going to show how to do things. But then we can even go and dig in and, select a short piece of the video of that presentation to say, this is the way you should do transeptal in this specific tools, and that differ from another tool, because for another PFA platform, you need to do the transeptal maybe more posterior rather than anterior. Give real practical recommendation and suggestion and show them. And that's what you do in RIO, in my mind. That's the strength of it. What we want to do is take piece of your RIO and, maybe categorize them in small tip and tricks for, colleagues, students, and sometimes patients. They want to hear what we do.
Yeah, I agree. I think one of the defining aspects of RIO Congress is its use of both live and recorded case presentations. And this is the 5th edition. We've had 4 years of successful virtual content that we have been able to deliver to a global electrophysiology community, all free, and that's since you mentioned about since COVID, how disseminating knowledge has, that's where this all started for us, 4 years ago, when Dr. Richard Schilling, called me to be part of the RIO Coast directorship. That was the excitement for me, is, be at home, but still be able to participate in this global event that could deliver, and show cutting edge technologies. And, this year,
so
we are doing...
Let me ask you a question now,
Yeah.
Devi, let me ask you a question now. So can you please, since you asked me all the questions, now I ask you one. Can you tell me what are the highlights for this year? What do you feel like people should hear about the highlight of 2024 RIO conference?
Yeah, so it's a great question, and it's just around the block from us. It's so this year's RIO Congress is next week. It's November 20th through November 23rd. So in the past 4 years, the event was a 3-day event. This year we have a 4th day, which is focused on the U.S. physician. So we have a U.S. focus day, which is November 23rd. As I said before, one of the biggest things about RIO Congress is how we're able to, show both live and recorded case presentations. And to me, these sessions allow attendees to witness real-time application of new technologies. You mentioned PFA or, say, advanced ICE imaging, whatever it be, but it gives practitioners a chance to analyze techniques and decisions as they unfold in a case, right? So, and the beauty is that we have panel discussions with every one of these live cases and recorded cases by global experts. You are a faculty for many of our sessions, and thank you very much for joining our faculty this year as well, and all your support for the last 4 years. But these panel discussions by global experts, to me, bring so much more value in facilitating in-depth, case-based learning experiences. And to me, it brings diverse perspectives. They share insights that have shaped their healthcare system and their patient populations. And sometimes we forget that there's the practice of electrophysiology is global, and we get so honed in how we do things, and maybe there's another way of doing things. So to me, the ability to engage experts and ask questions directly, and being able to be on a virtual platform and engage with these expert faculty is amazing. The second thing is it's all available on demand. And so if you did miss it, you can always go back and watch it at your convenience, and even interact with the faculty on a virtual basis at a future time. Now, as I mentioned, this year we have 4 days. Day one is mainly focused on global innovations in electrophysiology, mainly pulse field ablation, advanced mapping techniques. We have cases from the US and Europe, both live and recorded cases. Day two is mainly based on complex cases, both AF, also AI integration, and that's something that's coming up quite a bit. The role of AI in personalized treatments, AI-driven systems and such, and how that's being used in EP labs. Day three is going to focus a lot on emerging devices, also advanced imaging. Now, we will mix this up through the days, but just the general focus is for us to kind of show all these technologies, all these cutting-edge new technologies throughout these three days of global RIO. Now, day four is our newest edition for this year's RIO Congress. And for the first time, we will introduce a U.S. focus day that's tailored to our American healthcare environment. And these sessions are going to expose, talk about latest guidelines, technology applications, all the newest technology that's currently being launched in the last year and in coming to the U.S. market, so people can get to see, hey, what's down the corner? What am I looking forward to in this next year? So really, really looking forward to this RIO Congress. And again, if you have not registered, please register at www.riocongress.com. It's free. It's, again, available on demand later, but we have a whole Saturday catered for the U.S. physicians.
That was great to hear. And this is exactly what the Academy, Arrhythmia Academy, wants to do. There are many meetings like this that you just described brilliantly, and thank you for having me again, where maybe, the people don't know RIO or they miss RIO. So what we want to do is have on the Arrhythmia Academy a way to link to RIO, to maybe have a short frame of the hot topic case, the live cases that you presented, in order to bring people to review all the live cases of RIO. So connect. And like your meeting, the RIO meeting, there will be many other EP Live meeting, for example, of live cases that are not recorded, that we can, invite every local small conference that are done, or small or big, that want to have a highlight of their live cases, even if they are on a different platform, and then really push people to connect with the leaders in the field from a practical point of view. Then we can expand to science and give the most updated indication, clinical trials, and then teach live cases. So our platform connects perfectly with the RIO cases, live cases platform that you have been doing, and wants to do this for many more like that.
Well, I think I really appreciate you letting us be part of Arrhythmia Academy, and I think the work that you're going to do through Arrhythmia Academy is going to be extremely innovative and really is going to make a difference in the practice of cardiac electrophysiology. So thank you again for taking the role as Editor-in-Chief for Arrhythmia Academy. And thank you to our audience for joining us for this deep dive into RIO Congress 2024 and Arrhythmia Academy's role in advancing the field of electrophysiology. We hope Dr. Di Biase's insights have given you a clearer picture of how global collaboration, cutting-edge research, and educational resources like RIO Congress is going to shape electrophysiology care. Thank you very much, Luigi, for joining us today.
Thank you, David. That is great. And you said it all. And the last thing I want to say is that it's very important for me to bring down the walls and have the world more unified, and having new people coming to EP, having no barriers, having them to see what other parts of the world do from wherever they are, instead of dreaming of going to Europe or US or Asia to see what is done in the lab. We can provide this with everybody staying in their home and deciding then where they want to train, where they want to study, where they want to go to see something. This is very important to make the world smaller rather than bigger in the education and dissemination of EP.
Thank you. Very well said.
That's all for this episode of Rhythm Interventions Unplugged. Never miss a beat. Make sure you subscribe to the podcast and please share your thoughts with a review. We'll be back next month with another episode. Until then, keep the rhythm going.